Chapter 11: Drug Labels and Dosage Calculations. The first key skill we're going to need as we begin discussing dosage calculations is the conversion from the metric system. And it's easy in that it's always in multiples of 1000. So say we're going grams to milligrams. 1 gram or 1000 milligrams are the exact same thing. And we do that by multiplying by 1000. Say we were going 1000 milligrams and wanted to know how many grams that was, we would divide by 1000. And it's just moving that decimal three places to the left if we're going to the left, or to the right if we're going to the right down the chart. Not to say that it will always be in metric. 95% of the time, 98% of the time, it will all be metric. Though sometimes, especially when you start talking about pediatric doses and things, oral medications, you'll start looking at teaspoons. 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters. A key aspect of medication administration is going to be reading the label. For here in our example, we begin looking at the trade name or brand name, which in our case is Pretend Med. Next, down below it would be the generic name, Pharmoid in this case. The drug amount, which is going to be the dosage, in our case, 250 milligrams. We're also going to have lot number and expiration dates that we need to know. Especially some medications will require you to document the lot number. In case the patient does have a reaction, we want to know exactly where did this come from. It's also going to have other key information such as storage. In this case, it needs to keep refrigerated, keep it away from light. Also, when reading drug labels, we want to be aware of some of those sound alike, look alike medications, such as atenolol and alpurilol. Those are very different medications. One is a beta blocker, another is a medication used to treat gout, prevent uric acid buildup. While they do sound similar, they are very different medications. In some cases, you may need to reconstitute a medication. And what they mean by reconstitute is that you'll get a vial that full of powder. In this case, we need to add usually sterile water to make this now a solution that we can then give our patient. We have a great diagram of that here on the right as well. One area that I see students miss a lot, usually students understand the math, and it's usually just a basic rounding error. You know, tablets and capsules, they can be rounded to the nearest half if they are scored. Some tablets can go to the fourths, but especially when it comes to medication math here for ATI or for our tests, you're never going to see smaller than a half tablet. Also, keep in mind that extended, sustained release, or controlled release can never be split. That destroys the properties that make it extended release. And now it's an immediate release when that medication was not intended to be that way. There are three general methods for drug dosage calculation: the basic formulas, ratio and proportions, or dimensional analysis. If you prefer dimensional analysis, I'm happy to sit down and work dimensional analysis with you, though I find the three basic formulas to be far and away the easiest way for medication math. And both will get you the same place. Once you start doing both ways, you're getting to the exact same place. They're doing the same thing. It's more just preference. Our first formula, and the formula that we're going to be seeing on our first test here next week, is going to be desired over half times volume, meaning we have our desired dose. How much do we want to give? Then we also have our medications, our dose on hand, and we're going to multiply that fraction by the volume. And it'll be a lot easier once we see an example. Remember that the dose is the desired dose, as prescribed, what we're wanting to give that patient. The H, the drug on hand, the dose on hand, is what we have available. And finally, we have a volume. So say want to give 10 milligrams, and we have on hand 5 milligrams and 2 milliliters. Well, that's going to be 10 divided by 5, which is going to get us 2. 2 times 2 is going to be 4. We want to give that patient 4 milliliters. A lot of math and tutoring as well. Don't worry. Here's just another example showing a little different way of this to be worded. Let me know if you have any questions coming out of here. Or feel like you need any extra math. I'm happy to sit down and run problems anytime. In the case of dimensional analysis, this is a method that a lot of schools teach. I kind of disagree with it. I feel like it's excessive for a lot of what we're doing, and it overcomplicates. At the same time, it is just math and algebra. We're getting the exact same place. It's just how you're setting up your formula. We're also, especially in pediatrics and critical care, be dealing a lot in weight based medications. And for this, obviously, we do many of our patient weights in pounds. And this is something that we're going to need to be able to convert because to do a lot of these weight based med administrations, we need to know what the patient weighs in kilograms. But that can also be pretty easy in that there's 2.2 pounds in 1 kilogram, meaning it's just a basic multiplication division. There is also the body surface area method, considered the most precise method for calculating drug dosages, and can be measured using the West nomogram or square root method. The patient's body surface area is measured in square meters and determined by the patient's height and weight. In this case, it is the most accurate, but it is going to be a lot harder than just weighing the patient. We're also going to be looking at the many different routes of medication administration, beginning with enteral. These are oral drugs available in tablet, caplet, capsule, powder, or liquid form. It's going to have advantages in that it's easy. The medication is absorbed in through the GI tract. You can also provide for sustained release with enteric coated medications that pass through the stomach to help prevent GI irritation. We're also can provide these medications down through NG tubes, through PEG tubes by crushing them. Though at the same time, we want to be very careful anytime that we're crushing a medication. Because again, we never crush an extended release capsule. We never crush enteric coated medications. And this is because those medications are designed with that coating for a reason. And once we crush it, we've completely removed that. We also never mix it with feeding solution, as there's things in there that could bind with the medication, preventing absorption. And we're also going to dilute that with 15 to 30 milliliters of water because we want it to be nice and fluid so that we're not clogging up the tube. Considerations when calculating dosage, such as injectable preparations, syringes, vials, ampules, meaning those glass ampules that you will still see in many settings. In the case of parenteral administration, we're talking about things like IV push, IV piggyback. This is IV medications we're placing straight into the patient's vasculature. For intravenous routes, there's going to be a lot of different ways we can measure it. Obviously, with IV push, we're just measuring right off the syringe. But what if we have the patient on an IV infusion and suddenly we're at a hospital, we don't have any IV pumps available? There is never enough IV pumps ever. You could have a million IV pumps, they'd still run out. In that case, we're going to go back to the old school method, in which case we're actually measuring those droplets in the drip chamber of the IV infusion. To calculate that drip factor, to calculate how much fluid we are giving a patient just by those drops in that drip chamber, we have an equation that's going to be volume times drip factor divided by time in minutes. Volume is in milliliters or cubic centimeters how much we want to give this patient. The drip factor is going to be 10 drops per milliliter, 60 drops per milliliter. It will be there right there on the package. And it's going to be very apparent of just how big those drops are. And by that drop factor, say it was a 10 drops per milliliter, for 10 drops would equal 1 milliliter of fluid. And then we can then do our calculations based on the volume we want to infuse times the drip factor, how many drops per milliliter, and we're always going to divide that by minutes because that's then going to tell us how many drops we need to see in 1 minute to give how much medication we want to. It's going to require just that basic information, our volume to be infused. How much do we want to give this patient? The drop factor, the infusion set, which, as I said, is going to be in very big letters right there on the front of the package, and our time frame, always in minutes. Back before the fancy pumps, this was how nurses gave infusions. And finally, wrapping up with critical care drugs. Most critical care drugs are titrated to patient response, and the patient's monitored closely for therapeutic effects and adverse effects. For our first question, a nurse is adding up a patient's intake and output. Intake includes 180 milliliters of coffee, 4 ounces of gelatin, a 12-ounce can of soda, 120 milliliters of water, which is the total intake. I'll pause here for a minute, give you a chance to add it up before we go to the next slide. How many ounces are in a milliliter? Or how many milliliters are in an ounce, I should say. And there are 30 ounces in a milliliter. So for that 4 ounces of gelatin, that would equal 120 milliliters. And for that 12-ounce can of soda times 30 milliliters is 360 milliliters. From there, we now have everything in these same units, milliliters, and we just add them up, totaling 780. For our next question, this is a desired over half, and this is more of like what we're going to be seeing on exam one. The patient's to receive 50 milligrams of meperidine. The medication comes in a concentration of 100 milligrams in 1 milliliter. Which of the following should the nurse administer? That be A, 0.25 milliliters, B, zero point 0.5 milliliters, C, 0.75 milliliters, or D, 1 milliliter. I'll give you a second on that one before we transfer it over. So our desired dose is 50 milligrams. Our dose on hand is 100 milligrams. And multiplying that by the volume, which in this case is 1. 50 divided by 100 is 0.5. In this for drip factors, we're going to save some of the drip factors for exam 2. A patient is to receive 100 milliliters of a fluid bolus over 2 hours. The drip factor for the IV set is 15 drops per milliliter. At which rate should this bolus be administered? So we want to give our volume, in that case 100 milliliters, times our drip factor, which is 15 drops per milliliter, and we're going to multiply that and divide by our time in minutes, which for 2 hours would be 120 minutes. Plugging that into your calculator, that is going to get you an answer of 12.5 drops per minute. So how can you give a half of a drop? You really can't give a half of a drop. So in which case, we're going to be counting on that drip chamber so that we see 13 drops occurring in 1 minute. Med math, it can seem complicated. I'm hoping a lot of you came in with a base of you've seen a lot of these in your LPN program. If anyone needs any practice help with math, I've got a lot of practice worksheets. I can put together a lot more, and we'll make sure that you're also coming to our tutoring sessions. We're gonna spend some time working on some math as well as reviewing the content from lectures. Anyway, that's all I got from this chapter. I'll see you in the next slides.